Hello, and thank you for joining me for the Ingham County Coronavirus Relief Fund Eviction Diversion Program training for HMIS. Today we're going to go through all the necessary steps to receive a referral, document a program enrollment and discharge, and track service transactions for financial assistance and case management. We're using the Service Point training site today to go through this workflow, and we're starting off on the Service Point homepage dashboard. The homepage dashboard contains navigational links on the left-hand side, but the most important piece for this particular program and this workflow is the 2 count reports down here. The left side showing outstanding incoming referrals to your agency for the eviction diversion program, and on the right side are the referrals that you've acknowledged and closed out. These numbers are dynamic and will change over time as you receive referrals and as you go to as you acknowledge the referrals, act upon them, and then close the referrals. These numbers are also links that bring up a pop-up window that show you the client records that make up the numbers here. To get started, I'm going to click on the number 2 underneath the outstanding incoming referrals. This brings up a pop-up window and displays information about the 2 clients that have open referrals. It shows the dates they were referred, the agency that referred them, which will typically be the Holy Cross Coordinated Entry Agency, the organization that the referrals are being sent to. In this case, we're using the Capital Area Housing Partnership Eviction Diversion Program. And then here it would show the referral, but these are outstanding referrals that we haven't acknowledged yet, so we don't have a referral outcome at this point. From this window, you can navigate directly to the client records that have outstanding referrals to review their information and then to close out the referrals if you're able to successfully contact the individual. So I'm going to use client ID number 200 for the training today to demonstrate the workflow requirements. It's important that these steps be followed closely as they're necessary for completing the record keeping and reporting requirements from MSHDA for this Coronavirus Relief Fund grant. Also, I forgot to mention that you may download this report into an Excel file to use offline by clicking the download full report button, excuse me. Now navigating to client number 200, I'm just going to click right on the ID number and it's going to take us directly to that individual's profile. We're now on the summary tab for our client, Sammy Newsom, that's been referred to us for eviction diversion. On the summary page, we see a snapshot of a lot of relevant information to the case. Here we can see that Sammy is part of a household with a daughter, that there's a release of information that's been documented with the Holy Cross just recently. There are currently no program entries or other service transactions. Here we see our outstanding referral. And down below, we see the information that Holy Cross filled out and the prevention assistance screening. This first table here is the client's contact information. This is the information that you will use to connect with the client, to learn about their situation, and determine their eligibility for the program. Once you've connected with a potential participant, you will need to document their release of information on your agency's end, and you'll also need to close out the referral. We can see here that Holy Cross did document a release of information. And seeing that, we also want to check the Client Profile tab. Down at the bottom, there's a section called File Attachments. Often, if a client completes a release of information form, or if an agency collects a verbal release from a client, they'll complete a paper form to document that the client has consented to have their information shared on HMIS, and that document will then be scanned and uploaded and attached to the client record. Here we can see the first initial of the client's name, followed by the full last name, and then the EDP for Eviction Diversion Program, phone, ROI, and the date that the release or that consent was given by the participant. You can then click on the magnifying glass to download that document to save in your records. The release of information form that we use is a reciprocal release so that it covers all of our sharing partners. If you're able to download a completed release, you are able to use that release and don't necessarily need to get consent again from the participant to share their information back with Holy Cross or any of our other sharing partners. However, if you don't see a release here, you will want to read through the phone script to gather the client's consent to have their information shared electronically. And documenting the release is necessary to communicate information using Service Point. So without documenting a release, the other organizations working with the case or Holy Cross as the referring agency won't be able to see if any action's been taken on the case. So it's critical that the release of information be documented. To do that, I'm going to navigate back to the Summary tab, and under the Release of Information table, I'm going to click the Add ROI button. In this case, because we're working with a family, I'm going to check the box next to all the household members who are part of the case to extend that release to all of the household members. I'm going to say that yes, the release was granted, and I'm going to set the dates to mirror the dates on the release of information that was collected from Holy Cross, since we're leveraging that same document as they are that we downloaded from the client's profile. If you're gathering your own release of information, you'll want to put in the date that you talked to the client and got their consent to share information. The verbal release that we use is always valid for a 1-month period of time. We're going to plug in the date that the person gave their consent in this situation to Holy Cross, and then 1 month later is going to be the end date. Then click the Save Release button, and this table will update with our organization's release of information. In some situations, a case may continue after financial assistance is provided for case management for up to 3 months. If you're working with a case for longer than 1 month, it's important to renew or get an updated release of information after or before your current release expires. In those situations, you may have multiple records for release of information to cover the entire period of time that you're working with a case. After documenting the release of information, we want to close out the referral. To do that, we're going to click on the Edit pencil underneath the Outstanding Incoming Referrals. This brings us to the referral information. We are going to scroll down to the middle of the screen where it says Referral Outcome. Here we're going to select the option that fits the case. In our situation, we are able to contact or get in touch with the prospective client, talk to them, and preliminarily determine that they are eligible for the program and that they do wish to participate in the program. In that case, we're going to say the referral outcome is accepted. In other situations, such as not being able to contact a person, a referral may need to be declined or canceled. I think canceled would probably be more appropriate if you're not able to contact someone. And here you've got the option to identify why the referral is canceled or declined. And here they've got an option for unable to contact client. So there may be other potential reasons why a case isn't enrolled in the program, but right now we're solely addressing the referral and the fact that either we were able to follow up and make contact with the person, or we weren't able to contact them for whatever reason that might be. So for the purposes of the training, we're going to say that we accepted the referral. And then now that we've got an outcome in the referral, this is no longer going to be considered an outstanding referral. Once a referral has an outcome, it's then considered a closed referral. By being closed, that just means that taken the information sent to us via the referral and have acted upon it. It doesn't imply that the case was accepted or that assistance was provided. It's just that the referral has been acted on. Lastly, we're going down to the need status, and here the need is no longer identified. We're saying that the need is closed and the outcome is fully met because the referral has been acted upon and there's no additional action we need to take to process the referral. So with that information set, we're going to click the Save and Exit button. So to demonstrate, I'm going to click back over on the home link over here, and I'm going to click the refresh button underneath our count reports. Here you can see our number of outstanding referrals change from 2 to 1, and the incoming closed referrals change from 2 to 3. I'm going to click on the 3 here, and we can see client number 200 is now considered a closed referral. And over here under the referral outcome, it identifies that as an accepted referral. I'm going to navigate back to our client number 200 so that we can document their program enrollment. So back on Sammy's profile and on the summary tab, we're going to go to the entry exit table here and click on Add Entry Exit. Entry exit is synonymous with program enrollment. Here, because Abby is residing with Sammy, they live together, we're going to include Sammy in the program enrollment since they're both benefiting from the assistance. Underneath the type, we're going to select HUD. The project start date should reflect the date that you enrolled the household into the program. This may be today's date, or if you're doing data entry at a later date, you may need to change this to an earlier date. The time is inconsequential, so you can leave that as whatever it defaults to. Next, we click Save and Continue to expand the program enrollment intake screen. So here you see we're on the MS HMIS CRF Eviction Diversion intake or entry assessment. And some of the information is already filled in. This is the information that was filled out on the referral from Holy Cross. You don't need to re-answer or retype in any of this information if it is correct and accurate. But we do want to go through and complete all of the unanswered questions on this intake. The relationship to the head of household is used to identify the one individual who's considered the primary client. In every household, there may only be one client who's identified as the head of household, and everyone else is identified as another relation to that person. If you're working with a single individual, they are always the head of household. In our case, Sammy is the head of household here. So the date of birth is already entered, so we're going to identify the date of birth type as a full date of birth. Other information is consistent with what we've gathered from the client's application form, so we have no need to adjust that. For the client location, for every case that we enroll, we need to select MI-508 Ingham. This is linking the client's enrollment to our county. The MI-508 is the Ingham County Continuum of Care code. Similarly, for every case that we enroll, from the county of current residence, we are also going to select Ingham Lansing. So it's in there as Ingham Lansing because that selection also includes the portion of Lansing that actually lies across the Ingham County boundaries into Eaton and Clinton counties. However, we are all treated, everyone in the city of Lansing is treated as being as part of the Lansing Continuum of Care, the Lansing-Ingham Continuum of Care. Next, we have a question about disabling condition and whether or not a participant has this. In our case, we'll say that no, the client does not have a disabling condition. Even so, we need to answer the disabilities sub-assessment. Anytime you see a section or a question that's sort of sectioned off like this, that's called a sub-assessment. And really the only difference between this and any other question is that here we're able to identify multiple responses to one question. And so what we're going to do is identify a response to each of the listed disability types that we need to collect information on. And we answer this by clicking on the HUD verification button. This brings up the disabilities sub-assessment pop-up window. And in our situation, Sammy does not have any disabling conditions. You can click no up here and that will move all of the radio buttons into the no column. If you are working with a client who does have a disabling condition, it's easiest to also click the no button, but then click on the yes button for any of the conditions that the client might have. So for instance, if they had a physical disability, click on the yes radio button. That will bring up another pop-up window, and you do have to answer one additional question. So pretty much it's asking, is the disabling condition expected to be of long continued and indefinite duration and substantially impairs the person's ability to live independently? Or else you can simply go ahead and click the save button there. Having a disabling condition for the purposes of this program is really just a characteristic that helps us at a community level understand the participants who are being assisted with this program. And however, in our actual situation, our client does not have any disabling condition, so I'm going to make sure that this is set as no to maintain consistency with the rest of the record. And then save and exit. And you'll notice that the HUD verification button went from the red exclamation mark to a green check. The rest of the assessment or intake only needs to be completed for adult members of the household. The total monthly income is this adult's gross monthly income from all of their income sources. In this situation, our client is receiving $2,000 from earned income. Put in 2,000 there, and then again, clicking on the HUD verification button, we bring up the monthly income subassessment. Click No to identify No for all of the income sources, and Yes for earned income. And again, they're making, on average, $2,000 per month of earned income. Now, you should have third-party evidence of this in the form of copies of check stubs or benefit statements to document the participant's monthly income, as this is part of the eligibility criteria for receiving assistance. After you identify the amount of the income source, click the Save button to close the window. And be sure that you leave the end date unanswered. This represents that the income is ongoing. Also note that this is specifically monthly income. So if someone's received a one-time, lump sum payment or any type of income that's not recurring, that's not necessary to be entered here. This is only recurring monthly income that we're documenting. Now let's also say that we have that the client's also receiving child support, and maybe they get $200 a month in child support. I'm going to go ahead and click Save there, and now we've got all of our adults' income sources entered here. So I'm going to click Save and Exit. You can click on the View Gross Income table to see the gross monthly income and the gross annual income. Notice that my gross monthly income is $2,200 here, whereas up above I only entered $2,000. I'm going to want to go back and adjust that and correct my information. It's important that the answers between the monthly income table and this monthly income field up here are consistent. So this field should represent the entire monthly income for that household member. So I'm going to close this and go back up here and type in the correct monthly income amount. Also, if you want to look at all of the income sources as opposed to just 5 sources at a time, you can click on the magnifying glass in the left-hand corner to see all of the income sources in one table. You can also click on the column headers to sort the information to make it easier to find the records that you're looking for. Also, anytime you see the edit pencil, you can click on that if you need to make adjustments to the record. For instance, if you mistyped a dollar amount, so you can click on the pencil, go up here, and edit your dollar amount if that should be something different. Now we have non-cash benefits. In this situation, we'll say yes, they have some non-cash benefits. Clicking on HUD verification. Again, saying no to all of them, but saying yes to Supplemental Nutrition Assistance Program, or food stamps. There we're going to click Save and Exit. There's no additional pop-up to answer for non-cash benefits. Lastly, for the head of household only, we're asked to identify the number of months that the household is in arrears. So how many back months of rent do they owe? And here, we're always going to round up to the full month. So even if someone's made a partial payment, we're going to round that up. Instead of saying someone owes 2.5 months, we would just call that 3 months, even though the actual dollar value may not be 3 entire months worth of rent. And in this situation, we will say that they do owe 3 months of back rent. Next, we need to identify the range in which the household's income fits within the Ingham County area median income as defined in MSHDA's AMI tables. There's also an AMI table showing monthly or annual income limits for a household on the HMIS workflow guide. Our household, that is a family of 2, earning $2,200 a month, falls below 50% of the area median income. So that will be our selection here. This needs to be based on, so if you've got a household with multiple adults, each with their own income, you need to base your response to this on the combined total of the gross monthly income for all of the adult household members. In this situation, we've only got one adult with a total monthly income of $2,200, and so this family falls below the 50% AMI range for Ingham County. This question, the CRF eviction diversion referral outcome, is now part of the program discharge rather than the enrollment record. And this gives options for reasons why a person was not able to participate in the program or was not able to receive assistance from the program. And after testing the workflow, it was determined that, in most cases, we're not going to be able to answer this at the time that someone's being enrolled. We're going to enroll people, but then later we find out that the landlord is not willing to participate in the program. So if the landlord's not willing to participate, we can't help the client with this resource. We're going to close the case out, and then on the discharge, when closing the case out, we would identify the reason why. And we'll circle back to this when we go through the steps for documenting or closing the case. I'm going to click the save button, and you'll notice after doing that, all of my responses now have a green bar next to it. And this green bar is an indication to you that the record is saved. Next, we're going to scroll back up to the top of the assessment, and if you're working with a family or a household with more than one person in it, click on the next household member's name to jump over to their record and fill out the intake for that household member as well. The tenant applications should be collecting information for all of the members residing in the unit that they're seeking assistance for, and it's necessary to complete the intake for all members of the household. Abby is Sammy's daughter, so for the relationship to the head of household, we're going to identify her as the head of household's child. And then you'd continue to update all of the fields for Abby based on the information collected or reported to you in the application. Since Sammy is a minor, younger than 18, we're not going to answer any questions below this section header right here. So for children 17 and younger, it's just this small section of the enrollment that you need to fill out. Now, if there are other adults, you would add their income, but this section down here only gets filled out for the head of household. So it's only one client record that you answer these couple questions for. Now I'm going to save and exit. And I'm not going to answer these questions now for the training purposes. And just scrolling up to the top of our summary screen here, we can see our program enrollment. Next, we're going to document our service transactions. To do that, we can use our service table over here, and we're going to click on Add Multiple Services. When documenting transactions, we're only going to include the head of household. It's not necessary to include the other household members in the service transactions. In this situation, we're going to record the financial assistance or the rent payment assistance paid for this participant's back rent. You want to set the date as the date that you're actually, making the payment or cutting the check. You'll notice that the end date automatically changed to be the same date as the start date. And that's fine. It's not necessary to have the end date be anything different. We're documenting a payment or assistance that's already been provided, not something that's over time or spanning a period of time. Next, we click the pencil to identify the service type that we're entering and selecting rent payment assistance. We're going to skip over the service cost section and click on the small triangle here next to the Apply Funds for Services. The triangle will expand that to allow us to enter some additional information. And here we need to add in the funding source, the MSHDA CRF Eviction Diversion Fund, to this service transaction. We're going to click Add Funding Source. And in the search bar, you can simply type CRF and hit enter. This is the fund that we want to make sure we're selecting for all of our financial assistance. This is necessary for the reporting purposes so that MSHDA can monitor the spend down of this grant across the state and within each of the counties. So click on the green plus button to select the fund. So here, next, we're going to enter in the dollar amount that is being paid to the landlord from the CRF fund. So this amount that we're going to put in here, it doesn't need to include the client's copayment or any other amount. This is solely the amount from the eviction diversion fund that we're paying out. And in this situation, we're paying out $2,250. Next, we're going to set the need status to closed and set the outcome of the need as fully met. Again, it's not necessary to put in the client copayment or any other payment information here if the client is leveraging other resources to make a full rent payment. We only need to document the CRF eviction diversion funding. When that's complete, click Save and Exit. Then here you can see the date of our service, the provider of the service, and the service type. If you're working with a case that's also receiving case management services, you'll want to document case management transactions for the dates that they happen as well. I'm going to navigate back to the client summary page and show you how to add a case management transaction. Just like with the financial assistance, we're going to click Add Multiple Services. Scrolling down to the start date, we want to identify the actual date that we met with the client or interacted with the client for case management. Now, in this time, we're selecting case care management rather than rent payment assistance. For case management, we simply need to identify the date of the service and the service type. We don't need to apply funds for this. We do want to set the need status as closed and the outcome is fully met. If we need to add additional services, or if we've met with the client multiple times since we've last documented their services, you can easily add additional case management transactions by clicking on the Add Another button and plugging in the date for the other case management interaction you had with the client. And you can continue to add another to document as many transactions as you need to for this case or for this family. And save and exit when you're done. And here we can see the dates of our transactions and the service type. I'm going to return back to the client summary page. And the last part of the workflow, which is closing out the enrollment record. To do this, we click on the pencil underneath the exit date column, and then make sure that you're using the row that aligns with your program. It's possible that there may be participants enrolled in multiple programs, so you want to make sure that you're closing out their enrollment to the CRF Eviction Diversion program. Click on the edit pencil, and here, because both members are enrolled, we want to make sure that we're also including both household members in the discharge record. So we're checking the box next to Abby's name. And when doing the data entry, you always want to make sure that you're doing it under the head of household first, and then including the other members along with them. So you want to make sure you update the exit date. In this situation, I'm just putting in a future date for demonstration purposes, but more often than not, it'll either be, you'll probably be discharging someone the day that you're doing the data entry, or you'll be putting in a date that had already passed, so backdating an exit. In this situation, since we were able to help the family and avoid their eviction, they're considered as completing the program, and the destination, since all the participants are renters, the successful exit should likely be to one of these selections to a rental by client. Now, there are a variety of different types of rental by client selections based on the housing situation, whether that be in public housing, housing with no ongoing subsidy, so that would simply be a market rate housing. GPD TIP, that's a grant per diem transition in place housing. That's a special program through the VA, and we don't have any of that here in Ingham County, so you should not be selecting this for any of your cases. We do have housing choice vouchers, and people with housing choice vouchers are eligible for this assistance, so you may have some of those cases. There are other housing subsidies, rapid rehousing or a similar or equivalent subsidy, or else a HUD-VASH, that's a veteran-specific housing subsidy voucher, and we do have HUD-VASH in our community, so you may have some of those cases as well. Now, it is possible that you enroll the participant who then was not able to receive assistance from the program for any number of reasons, such as the landlord opted out, or the upon verifying income, you determined that the family was over the income threshold, or they didn't have documentation necessary to receive assistance, so they had to be discharged from the program without receiving assistance. In that case, you'd identify the reason for leaving as the need could not be met. On the destination, it still may be to the rental unit. It really just depends on what the situation is with the household at the time that you're documenting their exit. And then in a situation where you can't meet household's needs, either because the tenant or landlord doesn't want to participate or eligibility reasons, that's when we would answer the referral outcome. And I'll show you that once we get one step further. Back to this example of the family completing the program and returning to their market rate housing. So the training site has not been updated yet, but on the live site, the referral outcome question, which is just on the training site, is over here under the entry assessment. I'm going to bring that up now. That's this question here. This is now at the top of the program exit. If you're not able to serve a case, this is where you'd identify the reason for not being able to provide the assistance. So evictions that involve health and or safety issues can be assisted, but only if that is not the main reason for the eviction. So if someone is being evicted for non-payment, which is the eligible reason for receiving the assistance, and their case also has health or safety issues, you should identify that. Other than that situation, you would only use or complete this field for cases that don't actually receive financial assistance. And this is a way to for program managers to keep track of the reasons why people aren't able to get assistance through this program. If someone gets assistance, like in our case here with this test family, we're not going to answer this because we were able to help the family. So getting back to the exit screen, and really there's not anything else that needs to be added to the record on the exit screen. So there are some additional questions here, but these are not relevant to this eviction diversion program, and you're not required to answer questions about health insurance. If you find out that, if you have been working with a family, particularly with the 3 months of additional case management, maybe they have had some income change over that time. If there was, you would want to identify or document the change in income. So for instance, say the family now has additional earned income. Maybe they're making $3,000 a month now as opposed to $2,000. We would document that by opening up this record, and we're going to put in an end date for the $2,000 monthly income, and we're going to save that and add another record. And then notice I put in here 9/29/2020. Well, the family's exit date is September 30th. So we always want to end our old income amounts the day prior to the new one starting. Otherwise, if they coincide or overlap, the incomes will be double counted, and we don't want to overstate the household's income. So we always end date old incomes one day prior to the new one starting. So I'm going to save and add another, and now I'm going to put in the new income amount of $3,000 monthly income. And yes, they are receiving it. And there's our start date of 9/30 with no end date to represent that it's going forward. And now I'm just going to save. And then also circle back up here and make sure that that is also consistent with the family's or the household's current total monthly income. And here you can see between those dates, the client was receiving that amount of monthly income, but then as of September 30th, that income amount is now this. And you don't want to ever change this response here, because what that's saying is just that between this period of time, that was being received in that amount. So each record is specific to the dates in relation to it on that row. Again, you're not required to respond to any of the other questions, but you do want to, if there were changes to any other household members, like we did with the entry, switch the other household members and add or update any of their information that changed between their enrollment and their exit. When done, click on the Save and Exit button. and I'm not going to answer those questions now. So looking back at our client summary page, we've got our entry, exit, or our enrollment records and the date range of their enrollment. We've got their service transactions representing the different services or assistance that they received while participating in the program, and their release of information covering the dates that they participated. So since their case carried out until September 30th, I would have wanted to have talked with them and got additional consent to continue to share their information for another month. And again, you document that the same way. Typically you'd want to do this, soon after talking with them and getting their consent. In this situation, let's say that we, spoke with them on the 20th. It's okay if your dates overlap here. That's completely fine. And that just makes sure that we're covered past the expiration date of the other ROI. And if you are the one gathering this consent yourself, you can put your name in here as the witness. And that is the workflow for the Coronavirus Relief Fund Eviction Diversion Program. My name is Matt Stevenson, and you can contact me at matt.stevenson@lansingmi.gov if you have any questions about this workflow. Thank you.